Well, today I'm going to talk about another very common condition in children, especially the younger ones, which is diarrhea, which is actually the passage of loose stools, more than three in a 24-hour period by definition, and it is a very common condition, especially during the summer months. Now, this passage of water stools, and it can be more than three, it can be large in volume, can be very disturbing to not only the child but also to the parents. So, what the parents are worried about is actually the number of stools. What we as doctors are worried about is the effect of these loose stools on the body, and that is what we call loss of water and salts, which is dehydration. So, whereas both are important, I think it is good for you to know what causes this diarrhea. This is caused generally by some kind of an infection, and that usually comes from unsafe eating habits, maybe drinking something that is not clean, using a cup or a utensil or a spoon, for example, which has not been washed properly, sharing food with others, or eating fruit or eatables that have flies on them, for example. So it is generally infection, and most of the time it is what we call viral infection rather than bacterial infection. So what happens is that the child gets very uncomfortable and keeps passing stools, and it causes a lot of distress. The problem is that most parents will want to start treating it, and not surprisingly, a lot of them will use antibiotics on their own, or rush to a doctor and convince him to use antibiotics at times. So you have to understand that most of the diarrhea is caused by viruses, and therefore the treatment does not actually involve antibiotics except in a very few cases. So what you need to do is to make sure that the infant or the child is well hydrated. So don't stop feeding him. If he's breastfed, continue. If he is taking a normal diet and is not vomiting, you should continue. The only foods that you may want to avoid are sugary foods or fried foods, and a lot of milk, for example, especially if he's on cows or buffalo's milk. Otherwise, you should continue. There are some foods that obviously are better. For example, in fruits, bananas are very good, apples are all right. And in food, rice and khichdi, which is something that is very common here, is very good for this. Yogurt is very good. You can give some homemade juices, but they should be diluted. So avoid sugary drinks and give the child enough fluids. The other thing that you can do is to replace the water and the salt that has been lost, and that means oral rehydration salt, which comes in a powder, which you can mix in a jug of water and keep giving him every time he has a loose stool. There are some pre-prepared solutions that are available of ORS in the market that you can also use similarly. Now, if the child gets sicker, then you will know, because he will become very lethargic. He'll stop having tears when he cries. His lips become very dry, and he refuses to eat or drink, and just appears very sick. The other instance where he's likely to get very sick is if he's vomiting a lot. So if he's vomiting, becomes lethargic, and is passing less urine, and is irritable or becomes absolutely listless, then it is better for you to consult with your doctor or take him to the nearest hospital. Now, this is preventable. I have mentioned good hygiene practices, and there is a vaccine called the rotavirus vaccine, which is given during the first few months of life. Again,